Hello everyone, my name is Srishan Veeturi from the University at Buffalo. I'm a postdoctoral research associate in the Department of Neurosurgery, and this work talks about using a deep learning based hemorrhage segmentation model for automated assessment of intracranial hemorrhage. Now, intracranial hemorrhage is one of the leading causes of death worldwide and accounts for 10% of all the strokes. But traditionally, in a clinical setting, once an intracranial hemorrhage occurs, they try to estimate the volume of the hemorrhage using manual segmentation or manual methods. For example, currently they use an ABC by 2 method where they look at the volume on a CT image and try to approximate the maximum dimension of the hemorrhage in all three directions and divide it by 2, which is called ABC by 2, which is A stands for the length, B is the breadth, and C for the height. So it's three different dimensions and it gives a rough estimate of the 3D volume. But studies have shown that this does not correlate very well with the neurological outcomes, potentially because this is a very crude way of estimation. And in cases of intracranial hemorrhage, the accurate estimation of volume is paramount. Studies have shown that in the past, a 70% reduction of hemorrhage volume from, from before surgery to after surgery could result in an improvement in neurological output, which is quantified through modified Rankine scale, and or you can, if the final volume after the treatment is less than 15 ml, but if you use crude methods, which rely on manual segmentation and manual measurements, you may or may not end up with accurate volume estimations. So in this particular study, we have tried to use NN unit, which is a deep learning framework, to segment the hemorrhage volume from uh, CT images of patients. And we tried to compare two different modalities of this deep learning framework. The first one was based on 2D slices because a CT scan is traditionally made up of a bunch of 2D slices stacked together. So the first model that we evaluated was 2D slice-based segmentation, and then we stack all these segmentations to give us a 3D volume. And the second was a 3D um, convolutional neural network, which we use as our second model. And we also evaluated these two models in two different types of intracranial hemorrhage. One is the subdural hematoma, or SH, and another is intraventricular hemorrhage, where hemorrhage leaks into the ventricles of the brains. This figure over here shows you the results of the comparison. So on the y-axis, we have the predicted volume. So we generated ground truth by using manual segmentations from an experienced neuroradiologist. And the x-axis over here shows the volume predicted by the deep learning models. So over here, you can see the 3D model in general has a better slope as compared to the 2D model. Right here, the red shows the 2D model and the blue is the 3D model. So you can see that the slope of the 3D model is higher than that of the 2D model, which signifies a better performance and a closer estimation to manual measurements. Say in the subdural in all the cases. Now, if you subdivide them based on phenotypes, you see that in subdural cases, the 3D model performs better than the 2D model. However, in intraventricular hemorrhage or IVH, since the volumes are small to begin with, the 2D and 3D models are very, very comparable. And as far as the volume similarity indices go, we see the same trend. We see the 3D perform slightly better as compared to 2D, And however, when you separate them into subdural and intraventricular, you see that in subdural, the 3D outperforms the 2D, but the performances are very similar in the intraventricular hemorrhage cases. And these are all the p-values for the univariate analysis of all these features. And you can see that 3D is significantly better than the 2D model. These are representative cases where you can see, especially here, there are boundaries of on a representative slice as segmented by 2D and 3D. Now, what strikes you at first is that the 2D model has very sharp, jagged segmentations. Now, this is because you're segmented on a 2D slice and stacking of multiple 2D slices one on top of the other, which may not result in a smooth segmentation. However, with 3D segmentation, you see there is a smooth contour of the hemorrhage segmentation. And that we found was one of the most interesting findings of the study. So in this particular study, to conclude, we demonstrated that a 3D NN unit is performing better than the 2D NN unit and has a closer estimation. Now, the advantage of using this in a clinical setting is the time it takes for segmentation is saved, and you get a very good approximation of the hemorrhage volume. Thank you.